going to demonstrate how to put it all together, from scene safety and assessment, to providing compressions and giving breaths, to using an AED. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe, and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. Sir, are you okay? Are you okay? Help! Help! I need help! And ask someone to phone 911 and get an AED. You, phone 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, tilt the head back and lift the chin to open the airway and give 2 breaths with the mask. Remember, do not interrupt compressions for more than 10 seconds. Repeat. Now, tilt the head back and lift the chin and give 2 breaths with the mask. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay. Everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay. Everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.